Cavitron equipment from Dentsply, your solution for prevention. Dentsply offers you a complete treatment system for professional debridement. We are proud to present Cavitron, the ultrasonic scaler family. Cavitron Jet SPS, the perfect combination for debridement and polishing. The Blue Zone, for increased patient comfort. Cavitron Select, the portable ultrasonic alternative. FSI Slimline, fully autoclavable focused spray inserts. A complete range of inserts to satisfy all your scaling needs. FSI Inserts stands for Advanced Performance Without Fatigue. The contra-angled curves of the FSI Slimline right and left inserts represent curves of a double-ended curette. The left and right inserts optimize access to mesial and distal surfaces. Operator-guided overlapping strokes treat every millimeter of tooth surface. Simply roll the insert grip between the fingers to gain access to all areas of the furcation. Their smooth surface and shape permit the overlapping movements necessary for good access to furcations, concavities, and to the full depth of the periodontal pocket. The individual diagnosis represents a key element in the periodontal treatment. An initial visual examination of the oral tissues is necessary to define the amount of existing plaque and infection. The systematic probing will detect the periodontal pockets as well as determine the bleeding index. However, smoking reduces the level of visual bleeding. Disclosing solution will help in assessing the plaque index. For supragingival debridement, the power setting may be in the grey zone. The operator will have to adjust the water spray. Neither slow drip nor flow, but fast drip with spray is required. This is the FSI 100 insert, which can be used in all quadrants for moderate to heavy calculus removal. The operator will use the face and sides of the insert with an overlapping push-pull pattern of movement. Here, the broader surface of the FSI 100 is used to remove stain and calculus simultaneously. Here, the FSI 3 beaver tail insert only demonstrates in a non-working motion as if removing heavy interdental calculus or black stain on lingual areas. Here, the operator increases the power setting in order to remove older, heavier calculus. Now, decrease the power setting when working on sensitive areas as shown here with the FSI 100. The blue-gripped inserts are effective in both blue and grey zones depending on the amount and tenacity of the calculus. Remember, working in the blue zone increases patient comfort, which equates a smaller amplitude of the working instrument. FSI Slimline features a diameter similar to a periodontal probe, thus ensuring greater access to the depths of all pockets. Hold the handpiece in a vertical position. Flush the handpiece once daily and fill with water to eliminate air bubbles trapped in the handpiece. Keeping the handpiece upright, twist the insert to ease the placement. Do not hold the handpiece horizontally and empty the water that was used to fill the handpiece. After setting the power in the blue zone for increased patient comfort, the operator can begin subgingival debridement. The working area of the instrument, the FSI Slimline, is always parallel to the working area of the tooth. This is referred to as the 0-degree working angle. Notice that the pattern of movement is an overlapping pattern, whether it be up and down, as seen on the model, or slightly in and out, as seen in the patient's mouth. Depending on the quadrant treated, either the FSI Slimline left or right is used. This demonstrates a working stroke on the mesial surface of tooth 3-1, beginning at the line angle, then moving into proximally. Reposition and repeat the same sequence on the mesial of 3-2, using the back of the instrument. Since all sides are active, the operator can debride the tooth surface with the portion of the insert most easily adapted to the area of instrumentation. By depressing the foot pedal, a hands-free power boost is achieved as long as the light is on. The form-fitting shape of FSI Slimline inserts ensures optimal contact with the complex root surface morphology. This provides access into the furcation with minimal tissue distension. The instrument is controlled by the fingers, allowing for greater tactile sensibility. Observe the use of a stable fulcrum finger. Notice the rolling adaptation of the instrument and the push-pull motion being used. The right and left inserts are designed for subgingival access to the maximum depth of the pocket. This shows optimum access and adaptation with FSI Slimline to a molar. Grasp the insert with the thumb and index finger, leaving enough space, about 6 mm, to roll the instrument between these two fingertips. Contrary to many methods of teaching that involves full hand and arm movement, ultrasonic scaling is enhanced by feather-light finger movement. Full hand and arm movement are counterproductive. Never position the instrument tip 90 degrees to the working surface. The operator should never use the point of the insert, but instead only the sides of the instrument that are parallel to the tooth. Either a polishing paste, such as NuPro, which offers 3 different grits, or a sodium bicarbonate air polishing system can be used to polish the teeth. Again, notice the vertical position of the handpiece upon placement of the air polishing nozzle. Cavitron system offers the jet shield for reducing aerosols during air polishing. This increases patient comfort and operator visibility. Jet shield's design ensures that operators are working with the proper angulation and at the correct working distance to the tooth. The sterilized cleaning wire is removed before placing the nozzle in the handpiece. Depress the foot pedal once for a water rinse. Further depressing activates the powder spray. Many clinicians prefer Cavitron's air polishing systems for professional prophylaxis because of their superior efficiency, lightweight handpiece, and the quick results obtained. Air polishing has extended uses in maintaining implants, orthodontic appliances, and prosthetic devices. It removes heavy stain, such as chlorhexidine, particularly well. Air polishing technique involves use of a continuous circular motion aimed at the middle third of the tooth with approximately 3 mm working distance. Polish 1 to 2 teeth per 1 to 2 seconds and rinse. For increased operator and patient comfort, use a periodontic high-speed evacuator to capture excess spray. Simply rinse under running water and place instruments in the thermal disinfector. Never immerse instruments in a soaking bath with disinfecting solution or cold sterilization solution. Place thoroughly dried instruments in a paper plastic sterilization bag. Be sure to cut open the instruments bag with scissors. Do not push instrument through the bag. Here is the result. An atraumatic pink gingiva with smooth, shiny white teeth. Indirect light helps to identify areas of calculus deposits and stain. A brilliant result. Disclosing solution guides the operator to the areas to be instrumented. After ultrasonic debridement and air polishing, all calculus and stain have been thoroughly removed. The Dentsply equipment line provides effective therapy in the treatment of periodontal disease by removing plaque and plaque-retentive calculus. The innovative features of the Cavitron scalers and instruments provide a perfect combination of operator ergonomics and great clinical results with maximum patient comfort.